Hi guys, so today I'm going to talk about uterine cancer. So to start out with, uterine cancer is cancer in the uterus. It is the organ where a baby grows when a woman is pregnant. Here we see an image of a uterus. The uterus is part of a woman's reproductive system, and it is a hollow organ in the pelvis. So the uterus is made up of three parts, the top, middle, and the bottom. And it has two layers of tissue, the inner layer and the outer layer. So cancer begins in the cells, the building blocks that make up tissues. Tissues make up the uterus and other organs of the body. So tumors in the uterus can be non-cancerous and cancerous. Cancer cells can spread quickly by breaking away from the uterine tumor. They can travel through lymph vessels to nearby lymph nodes. And I'm going to go over the 5 different stages of uterine cancer. So stage 0 is when the abnormal cells are found only on the surface of the inner lining of the uterus. And here we see a graph of stage 1 and stage 2 of uterine cancer. So stage 1 is when the tumor has grown through the inner lining of the uterus. Stage 2 is when the tumor has invaded the cervix. Stage 3 is when the tumor has grown through the uterus to reach nearby tissue, such as the vagina or the lymph node. And finally, we have stage 4. And stage 4 is when the tumor has invaded the bladder or intestine, and other cancer cells have spread to other parts of the body far away from the uterus, such as liver, lungs, or bones. So some risk factors of uterine cancer. So being 50 years or older is a risk factor. Also being overweight, women who are obese and have a greater chance of developing uterine cancer. And someone in your family having had cancer of the uterus, ovary, or colon. Also, an abnormal increase in the number of cells in the lining of the uterus is a risk factor for uterine cancer. So the most common symptoms of uterine cancer are abnormal vaginal bleeding, spotting or discharge, pain or difficulty when emptying the bladder, pain during sex, and pain in the pelvic area. So there are 4 common treatments for uterine cancer. So we have surgery, radiation therapy, chemotherapy, and hormone therapy. Okay, so surgery is the most common treatment for women with uterine cancer. The surgeon usually removes the uterus, cervix, and nearby tissue. This includes the ovaries, fallopian tubes, nearby lymph nodes, and the vagina. So after surgery, women who haven't gone through menopause yet will stop having their menstrual periods, and they won't be able to become pregnant. For some women, it can affect sexual intimacy. Next, we have radiation therapy. Radiation therapy is an option for women with all stages of uterine cancer. It may be used before or after surgery, and for women who can't have surgery for other medical reasons, radiation therapy may be used to destroy cancer cells in the uterus. And radiation therapy uses high energy rays to kill cancer cells. It attacks cells in the treated area only. So next we have chemotherapy, and chemotherapy is when doctors use drugs to kill cancer cells. It may be used after surgery to treat uterine cancer that has an increased risk of returning after treatment. So chemotherapy for uterine cancer is usually given by vein. It is usually given in cycles, and each cycle has a treatment period followed by a rest period. And finally, we have hormone therapy. Hormone therapy may be used for women with advanced uterine cancer. Also, women with stage 1 uterine cancer who want to get pregnant and have children choose hormone therapy instead of surgery. Okay, so some ways we can prevent uterine cancer are to take very good care of yourself. This includes eating well and eating enough protein to keep up your strength. And also eating well will help you have more energy. So to prevent uterine cancer, you can also get a pelvic exam, an ultrasound, or a biopsy. And also a blood test. So your doctor can check your uterus, vagina, and nearby tissues with a pelvic exam. And in an ultrasound, the picture can show a uterine tumor. So for 2018, there are going to be an estimated of 63,000 new cases of uterine cancer in women in the United States, and there will be about 11,000 deaths. So the number of uterine cancer cases was 26 per 100,000 women per year, and the number of deaths was 4.6 per 100,000 women per year, and this was based on a 2011-2015 study. So in 2015, there were an estimated 727,000 100,000 women living with uterine cancer in the United States. So uterine cancer is the fourth most common malignancy diagnosed among U.S. females after breast, lung, and colorectal cancers. Obesity, late age, at menopause, and early age are known factors of endometrial cancer. And smoking, as well as oral contraceptives, are protective factors. So white women have a higher chance of incident rates of uterine cancer than any other ethnic group in the United States. And African Americans have a higher mortality rate that is 79% higher than the rate in whites. And there is little data available on the cancer among Latinas and Asians. And that is all. Thank you.